Parliamentarians, our primary responsibility is to make sure the children in this country have hope, and we're failing them. I want to thank the Minister for positive words on Attawapiskat, but as the community said to me this morning, it shouldn't take a state of emergency to get mental health workers to fly into a region where we've had 700+ suicide attempts. There was no money in the budget for mental health services for Indigenous children. I want to ask the Minister, what's it going to take to end this cycle of crisis and death among young people? What are the concrete steps for the long term that they're going to put on the ground, not just in Attawapiskat, but all the Indigenous communities of this country?
Well done, sir.
The Honourable Minister of Health.
The honourable member will find no argument with me that, in fact, we need to find a way to restore hope for these communities, and particularly for the young people who consider taking their lives. In fact, the budget, as the honourable member may know, includes $8.4 billion in funding for Indigenous communities. It is these funds that will actually restore hope to communities. When we invest in education so that these young people will have a standard of education that every Canadian child should have, it will renew hope. When we invest in these communities so that people will have adequate housing and not be faced with overcrowding, we will find hope.
Member.